Hello and welcome to Pharmacy Times News Network. I'm Ned Milankovich and your guest host for our Pharmacy Week in Review. Officials with the FDA last week approved Merck Sharp & Dohme Corporation's Odactra, the first Allergan extract to be administered sublingually to treat house dust mite-induced nasal inflammation, also known as allergic rhinitis, with or without eye inflammation, in adults aged 18 through 65. The once-daily tablet gradually trains the immune system to reduce the frequency and severity of nasal and eye allergy symptoms. For the first dose, patients must be observed for at least a half hour for potential adverse reactions. It can then take about 8 to 14 weeks of daily dosing for the patient to begin to experience a noticeable benefit. The most common adverse reactions were nausea, itching in the ears and mouth, and swelling of the lips and tongue. Odactra includes a boxed warning of severe allergic reactions. As with other FDA-approved Allergan extracts administered sublingually, patients receiving Odactra should be prescribed auto-injectable epinephrine. The FDA also announced approval of Noctiva, desmopressin acetate. The nasal spray is indicated to treat adults who experience nocturia due to a condition known as nocturnal polyuria, which causes the overproduction of urine during the night. Noctiva, marketed by Renaissance Lakewood for Serenity Pharmaceuticals, is for individuals who awaken at least 2 times per night to urinate due to nocturia. It is taken daily, approximately 30 minutes before going to bed, and helps increase the absorption of water through the kidneys to decrease urine production. Noctiva is approved with a box warning and a medication guide due to its potential to cause low sodium levels in the blood, which can be life-threatening if not promptly diagnosed and treated. Patients with symptomatic congestive heart failure, uncontrolled hypertension, and certain nasal conditions should not use Noctiva. Pharmacists may receive more questions about Viberzi, the daily medication for treating irritable bowel syndrome with diarrhea, or IBS-D. The prescription medication claims to proactively manage both symptoms of IBS-D, and each commercial depicts a patient who misses out of various events because of the comedic tyranny of Irritable, the personification of IBS-D. The patient finally asks her doctor about Viberzi to help gain control of her all-too-eager companion. Pharma company Allergan has been running the campaign since last year, and the comedian who plays Irritable has garnered quite a bit of attention and raised awareness for the condition, which most often strikes women. Finally, Colorado has passed legislation authorizing pharmacists to prescribe birth control after obtaining additional training. They are the third state to follow California and Oregon with this statewide authority, specific to birth control. There have been some concerns about the safety of providing hormonal contraception without physical exams and pap smears. Although hormonal contraceptives are not without risks, these are generally outweighed by the benefits and considered safe for most women. Women will need to complete a health history questionnaire and have their blood pressure taken at the pharmacy. The pharmacist will use this information to determine which methods of birth control are safe. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Ned Milankovich at the Pharmacy Times News Network.